Okay, so welcome to my talk, which is titled The Psychological Effects of Living Without a Stomach. I'm really excited that all of you are here and willing to participate in this session today. I am Dr. Amanda Rhodes, and I am a clinical psychologist. I'm at the National Institutes of Health in Washington, D.C., specifically at the National Cancer Institute. And I am housed in the Health Psychology and Neurobehavioral Research Group. And I do a lot of work with Dr. Davis's surgical oncology branch. And that work specifically is seeing a lot of patients therapeutically who have gastric cancer and are undergoing some sort of gastrectomy process. Maybe it's pre-gastrectomy, during, or after. So just a quick conflicts of interest statement. I have no financial disclosures or conflicts of interest with the presented material in today's presentation. So in terms of an overview of what I'm going to be talking about today, first, I'm really going to introduce why mental health matters. You're here for gastric cancer or for a physical condition, and I'm going to really discuss the ways in which mental health makes a big impact and why it's really important for us to be at the table and be part of your team to help provide you care. Then I'm going to, after that, introduce quality of life and what we look for when we're looking at how you're doing and how you're functioning, because that actually has a broader definition than just physical health. So I'm going to introduce that to you. I'm going to introduce some of the ways that I have seen working with some of you all that are areas of quality of life that are a challenge and that we work on. From there, I'm going to introduce what working with a mental health professional might be like. And that means finding meaning and then working with challenges that are inevitably going to come up. So barriers that are inevitably going to come up during your treatment course. And then I will be around for the panel for questions and discussions afterwards. So to start, physical and mental health work together. They are interconnected. So I am a clinical health psychologist, and what that means is that I have training and expertise in how physical and mental health are interacted. So here's a little depiction of that, and what that really means is these biopsychosocial factors, and I'm going to go into what that means, so just hang tight. These biopsychosocial factors do influence your physical health and illness. In turn, physical health and illness influences biopsychosocial factors. And so that's really what I study and what I treat and what I intervene on. When I say biopsychosocial factors, which is kind of our mental health range, we think about the bio aspect of who we are. That's your physical health, your genetic vulnerabilities, your sex, drug effects, neurochemistry, stress. You know, your physicians really are experts in this area. And then I really come into play in the psychological and the social factors, which are things like mental health, social skills, behavior, emotions, even things socially like your peers, your family circumstances, your family relationships, your education, your socioeconomic status. So how all of those areas of your life influence physical health and vice versa. And so that's what health psychologists or mental health providers that specialize in working with individuals with chronic health issues really look at. And Rachel Lopez, registered dietitian, my colleague at the NIH, in her talk, I'm sure she showed this illustration. And with gastric cancer, you will be working with a multidisciplinary team. And that team, you know, the best care comes from a team filled with surgeons and dietitians, pharmacists, social workers, nurses, physicians assistants, and mental health providers. So she in her talk was really talking about the nutrition aspect as a registered dietitian. Today, I'm going to be talking about this social support. So at the seat of the table of your well-rounded holistic care can be and really should be mental health providers. When I say the term quality of life, what I'm getting at is how you are functioning in different areas, including your physical health, equally including your mental health, equally including your social health. This takes a really well-rounded, holistic perspective to your experience. Now, it's very possible up until now, your physical health has kind of had like been more highlighted, and that's perfectly great. That's perfectly fine. And what I do as a mental health provider is I come in and start to look at the interactions or how your mental health is doing with your physical health and social health. So physical health, in terms of quality of life, we're looking at your physical condition, okay? Your physical functioning, your mobility. That's a big part of quality of life in physical health. Your satisfaction with your physical functioning and, your health history, your prior health. Equally, in terms of quality of life, we also look at mental health. So the domain of mental health includes things like psychological distress, at the same time, psychological well-being, anxiety, depression, emotional experience, your cognitive functioning, which are things like planning and memory and processing, and then your social health. So is another equal part of your holistic quality of life. And social health, we're really looking at family functioning, marital functioning, how you're functioning in your social relationships, parenting. And you can see that this is a Venn diagram, so there's quite a bit of overlap between some of these categories. For instance, between physical and mental health, the overlap really comes into play with, the domains that we look at, like energy and fatigue, sleep problems, your perceptions about your health, your physical symptoms, your distress about your health, pain comes into play in between physical and mental health. In terms of the overlap in mental and social health, things like belonging and your social role, and then socially and physically, maybe some role limitations are due to physical problems. And I'll talk a little bit about the ways that impacts our post-gastrectomy patients. Here, I just want to highlight that this is overall what we look for in quality of life in everybody, right? Like in the person sitting next to you, in everybody, we're looking at quality of life in this holistic way. Our post-TG patients, there are some things that we know from working with them that we like to highlight and look specifically at, and those are physical functioning tends to be one that we're really looking at, and mobility, especially directly after TG, your mobility might be a little bit shaky. We've also seen pretty common, one of the areas that we kind of try to work up and assess in terms of your quality of life is this energy fatigue and pain or discomfort, especially really soon after your total gastrectomy or whatever type of treatment you get. So everybody is different, right? Right now, it's very hard to predict how your body is going to respond to a gastrectomy. I have seen siblings have totally different courses. I've seen family members, parent-child dyads look totally different. But some of the potential challenges that tend to come up in our post-gastrectomy patients are fatigue, nausea tends to come up. I think Rachel probably mentioned that a little bit. There's some bile reflux as well. Physical functioning tends to be a challenge, pain and discomfort, especially, immediately post-gastrectomy when you're recovering. We also tend to find some difficulty eating. and difficulty drinking, which I know that Rachel talked about in her presentation, because you've changed your stomach, we've taken it out. And so it's not the same experience that we had previously eating and drinking, and our bodies can't hold the same amount, and they can't hold the same foods. With that tends to come weight loss. So that is another potential challenge that comes up with our post-gastrectomy patients. Now, these things matter when they are getting in the way of living a meaningful life and moving forward in your medical recovery. So at any given moment, one or all or none are going to come up, but they're important when they're getting in the way. So as Rachel, who's a registered dietitian, spoke to you about, that the post-gastrectomy life is really a pretty intense nutritional course. And you will very likely be asked to follow a set of dietary and lifestyle guidelines. And this can sometimes be difficult because of all the things that are listed in this slide. If you have to eat on a certain schedule, right? Like, so you are assigned to eat certain things on a certain schedule, or drink, right? Certain drink on a certain schedule, and you're experiencing nausea, right? We will often want to just say, okay, I'll wait a little bit, but all of a sudden that whole timeline of eating and drinking gets pushed back. And so can we work with some of these things that come up so that way you can continue to be on course with your nutritional guidelines? In addition to the things listed here, from what I've seen as a clinical psychologist, some other challenges that sometimes come up with our post-gastrectomy patients is sometimes they experience a sense of, or a feeling of loss about their stomach or about their eating habits, sometimes a change in identity because they went from working to not working, or their family or social roles changed. This is especially true like immediately after gastrectomy, while you're in that, you know, early recovery period. So that is one thing, a couple things that I see that come up. Now I bring this up because how do we work with that, right? So you can actually work with somebody who has specialized experience in individuals with health conditions. And what they're doing is helping them navigate the individual and unique challenges that come from not only a cancer diagnosis, but also the course of treatment. While you're certainly in the driver's seat here, an experienced licensed professional can help by sitting in the passenger seat with a map and show you a map. And your foot is on the gas or right next to the brake, you're certainly in the driver's seat, but you're not alone. And so you can work with somebody who might be helpful and kind of show you the way to work with some of these challenges. As a clinical health psychologist, I have specialized training in the interaction and clinical treatment of mental and physical health, like I showed you in that diagram a couple slides before. I use specifically an evidence-based approach called acceptance and commitment therapy, or acceptance and commitment training. We call it one word ACT. And by evidence-based, what I mean is that it has been studied rigorously through science and research as a treatment as in influencing health and well-being. And what we're doing in ACT is we're building the skills to move you towards a meaningful life when you're thrown curveballs, right? And those curveballs could be bigger things like a cancer diagnosis or a treatment, or it could be day-to-day, moment-to-moment curveballs like nausea or bile reflux, I know Rachel talked about. So what happens, and when those come up, how do you move towards a meaningful life? In the next few slides, I'm going to give you a taster of how we might work with ACT with somebody who just went through gastrectomy, who no longer has a stomach. And I'm going to give you a taster on some of the things that I do when I work therapeutically with these patients. I know, especially for some of you in the audience, if you've never worked with a mental health professional or a therapist, it can be pretty scary because you don't know what it's going to be like. So what I'm hoping, my intention is that in the next few slides, you'll get a taste of what it might be like to work with somebody, and see that it's not that scary. So to start, the question is, why do we do this work? Why do we do the work of working with a therapist or a mental health professional? Why do we dive into discomfort sometimes that inevitably shows up? As I've said before, the post-gastrectomy life can look very different, especially at the beginning. And it's important to recognize and understand what is important to you, and then how best to get there. You may be limited for a period of time in engaging in your previous activities like exercise or hiking or sports or working, whatever it is for you. But what we can do is we can find other ways, other new ways to get at those values. At the same time, you will also be asked by your team to follow a set of nutritional guidelines. So that way you can live healthily without a stomach. But that can be sometimes hard due to pain or discomfort, or sometimes you're just not feeling it, or sometimes your mind is handing you really sticky thoughts, which I'll kind of go over in a minute. So can we use this approach? Can we find meaning for those moments that are hard? And when I say meaning, I'm talking about values. Values are the things that are intrinsically motivating for you, the things that you really deeply care about in your life. I tend to use the word valuing instead of values because I think that it highlights that this is an active process, it's an active behavior that we engage in when we talk about values. And values are not goals. Goals are more specific desired events, things that can be obtained or not. So in a sense, when goals are achieved, they're complete and they're done. So things like a job or a house or a marriage, whatever. However, values are more like in life directions. They can never really be obtained. They're always there for us to act upon, and it's how we want to show up. Values are intensely personal, and they sometimes feel like people try to impose them on us, and that's not really how it is. So working with a mental health professional, you're really trying to decide and explore what you as an individual person care about. For instance, I like to think of it as your favorite flavor of ice cream. So like my favorite flavor of ice cream is chocolate chip cookie dough, but your favorite flavor of ice cream might be something totally different. And that doesn't mean that my flavor is better than your flavor. It's just different in my life versus your life. So when we do values exploration, we're doing it towards what you actually care about, and nobody else really gets a say with that. Overall values are what brings meaning to your life. So this question in the bottom right-hand corner is, how do you want to show up for your life? And this picture on the slide depicts all the areas of living. So these aren't necessarily values, but they're areas of living that you can then define values. So within your family relationships, how do you care, or how do you want to show up for your family relationships? Do you want to have family relationships that are communicative, are supporting? For health, do you want to have energy to do the things you care about, right? And so that may mean, do you want to have a nutrition guidelines, like Rachel said, in order to get energy and vitamins that are going to be healthy? Or personal growth, right? How do you want to show up to personal growth? Do you want to continue to be a lifelong learner? Or community, do you want to be accessible and supportive or helpful in your community? So that's where valuing and the values work come into play early in working with your post-gastrectomy life. Now, you might be having the thought, can I even live a meaningful life without a stomach? And the answer is absolutely 100% yes. Okay. And how we do that is we then sometimes need to rework how we view what's meaningful. So in your post-gastrectomy life, and reworking values to fit this new lifestyle, especially early in your course. By reworking, what I mean is it really that we care about eating out at a restaurant, or is it actually the warm connection that we feel with our family or friends when we're sitting around a table speaking intimately to each other? And are there ways to get at that warm connection that fit your new lifestyle and maybe your energy for the day, or your fatigue for the day, or your pain? Another one that comes up is sometimes around food, not necessarily having the meal immediately post-gastrectomy, but if we know that it's really the connection that's meaningful within food, can we do things like create recipes or help a family member cook the meal? Or if it's helpfulness in the household, maybe it's not cooking the meal because we don't have enough energy, but maybe it's doing other types of housework. So really reformulating what actually are the values, not necessarily goals, but what are the inherent values like connection or intimacy, and then coming up with new behavioral actions, new behaviors that are going to fit your immediately post-gastrectomy lifestyle. And it's just going to look a little different. So you know what your values are. You get to the point you know what your values are, and then things get in the way, right? So you're on a life towards values, you've explored your values, and all of a sudden it's like, well, I'm just not moving towards them at any given moment. Well, challenges show up, right? So we sometimes have thoughts and physical sensations and feelings that get in the way of moving us towards our values. So, for our post-gastrectomy patients, some of the thoughts that are really sticky that come up for my patients that sometimes get in the way and control us are things like, I don't want to eat, or the thought like, I wish I could just skip this part of recovery, or this is too hard, or the thought, will eating this particular thing make me sick, right? Those are pretty common ones that the mind hands you post-gastrectomy. Physical sensations come up as challenges to get us to move us towards values, and physical sensations like fatigue is a big one that comes up, and nausea and pain and discomfort sometimes. So those might come up and act as a barrier, and also even feelings like self-criticalness, sadness. A big one's food anxiety. I tend to see that a lot. So when you're post-gastrectomy, foods that maybe before gastrectomy didn't really impact you aren't really making you feel that too hot after gastrectomy. So then sometimes anxiety over time comes up around food and what we can eat, and just noticing that our playfulness with food needs to be worked on because there's so much kind of subsequent nausea or something like that. So what do we do about this? Right? So if we have values and then we see barriers that are getting in the way, what can we do? I'm going to give you over the next few slides just a taster of some of the things that we work up, some of the processes that we work up when we're talking about challenges, when we are working directly with the day-to-day, moment-to-moment challenges that come up, and how we move forward from them. So the first one that often comes up is our mind, right? So our mind post-gastrectomy hands us lots of sticky thoughts. And by sticky, I mean they just don't go away, and they maybe a little bit are impacting and dictating our behavior because they are strong holding us. So the big ones I see are, I don't want to drink right now, right? Because water is really like a usual drinking schedule of water is really important. So I don't want to drink right now. I don't want to eat right now, or I'll just wait out this feeling and then eat after. So when we work with thinking, what we're doing is we're just releasing the grasp that these thoughts have on us. And we're moving from a perspective of fusion, which is being caught up with our thoughts. Like, if you've ever ruminated or had anxiety, it kind of feels like a tornado. So moving from being caught up in our thoughts and allowing them to dominate our behavior. For instance, the thought, I don't want to drink right now, and then not drinking, right? So it's dominating the behavior, to a diffused perspective, which is more separating, distancing, taking perspectives, taking outside the perspective from our thoughts and letting them kind of come and go. It's looking from your thoughts to looking at your thoughts. And if you notice from this animation that I just created on the screen, I didn't get rid of the thoughts. I didn't change them in any way. I just made them not as bright, because sometimes they scream, and what we're doing when we're working with a mental health professional is we're just like lowering the volume so that way we can see all the other thoughts that are coming up, because these ones tend to be really big and really loud. And you have other thoughts, but these ones tend to overpower it. So if we can work with taking perspective on our thing in this way, we can see maybe the other thoughts that are going to be more helpful for us to get us towards values. Another process that we work on in therapy, especially from an ACT approach, is present moment awareness. Okay, so as humans, we get really caught up in the past. And for our gastrectomy patients, our cancer patients, often it's thoughts like, where did my discomfort come from? Or the last time I did this, I had nausea. Into like future thinking, like thoughts like, what if this doesn't solve my pain? My bile reflux will be here forever. When will the bile reflux go away? If I just get my discomfort to go away, I can then eat, right? And it's really beautiful that we as humans have the ability to language in that way and have memory. And life does not exist in the past or the future. In fact, life only exists right now, in the here and now. So when we focus on the here and now, we can then choose the behavior that moves us closer towards those values, like eating or walking or spending time with loved ones. We can choose that behavior rather than maybe an immediate behavioral response to just get out, escape, get rid of, dampen discomfort. So this is all really great. And you're probably thinking like, okay, but how do I do this, right? So one way that we can start to work with present moment awareness and build it up like a muscle is informal mindfulness practice. And you might see the slide, you might say, I cannot meditate. Like, that's not for me, that's not on the docket. What I mean by informal mindfulness practices is not eyes closed meditation. When we're working up mindfulness, really what mindfulness means is a perspective on the present moment, on the here and now, in a way that's descriptive and non-judgmental and compassionate. So can we show up to this moment here and now without the judging mind? And we can practice that very informal ways, like making the bed or eating, walking, washing your hands, taking a shower, drawing, playing music. A lot of these things you're already doing in your daily life. So if you're just adding this lens or perspective to it, there's no extra time here. And so something like making the bed is, when you're doing any of these activities, just doing that one activity, we are very much multitaskers. And so can we, in a few moments of our day, just do one thing? And can we do that thing in a way, in this perspective, where we're just scriptively noticing? So we're just labeling, we're just noticing all the sensations that come up when we're doing this. So when we're making the bed, can we notice that the comforter feels different than the bed sheet, right? Can we notice how our body feels as it's moving around? Or washing your hands, can you really deeply connect with that feeling when you turn on the water and it's cold, to noticing when it kind of becomes more warm? Just being really present with that. Even eating, right? So if it's only a few bites that you're having, slowing down, noticing the texture of the food, noticing maybe the smell or the color even, and just taking it really slow and noticing if your mind is handing you some judgmental thoughts like, oh, I'm not going to like this, or I am going to like this, like noticing all the things that our mind says to us in those moments. That's just a really, really short way to get at this practice. The last few slides is just, the tip of the iceberg in terms of what you might do in therapeutic work. There are lots of exercises, there are lots of processes to build up this, but it gives you a good perspective on some of the things that you might do. Now, moving forward, as I kind of close out here, when you are managing your mental health, you really want to make sure you're receiving mental health care from a qualified, licensed professional. And what I mean by that, and what I mean by a licensed mental health professional is if they're licensed, they must meet national standards to become qualified. They must have a bachelor's degree. They must have a master's degree in psychology or a related field. Some disciplines like psychologists have to have a doctorate degree, but everyone has to have a master's plus. They must have completed an accredited supervised practicum experience in addition to their master's degree. They have to pass one or more national board exams, and they have to complete training, these like continuing education trainings every year, every 2 years to maintain their credentials. So they're constantly learning. So that's why it's really important to make sure you're working with a licensed professional. The easiest way to find a therapist or a mental health professional is to ask a member of your healthcare team, which you probably already have a healthcare team. So that's the easiest way. Ask them for a referral. They either have somebody on their team like we do, or they know somebody in their department or in their institution, or they know referrals into the community, right? And they will work with you to get those referrals. So that is first and foremost the easiest way. A therapist in general could be anyone that's a health psychologist like me. They could be a clinical social worker, a professional counselor. There are other ways that you can also find a therapist. If you particularly felt comfortable with the approach, that ACT approach, the acceptance and commitment therapy approach that I kind of introduced today, if that felt like it was a starting place, you can go to this website called contextualscience.org. There's a big button at the top. I think it's green, it's a square, and it says Find an ACT Therapist. And it's basically a directory of everyone that does what I do. And you can search in that directory by location. You can search by expertise or population. My suggestion would be the term health psychology or oncology. Another option is psychologytoday.com, and you can, on that one, you can search by location, expertise, even insurance. So people that have gone through gastrectomy have unique needs and a unique post-surgical course. They have specific challenges to this population to adjusting to life without a stomach. And you will be asked, or they will be asked to follow a set of post-gastrectomy diet and lifestyle guidelines. And you will work with a multidisciplinary team, an experienced multidisciplinary team, filled with, before and after surgery, filled with surgeons, oncologists, dietitians, pharmacists, social workers, nurses, physician's assistants, and mental health providers, okay? And working with a mental health professional can help you find meaningfulness in your new life and decrease the impact of the challenges along the way. So I hope from this talk you can see why mental health is important in your journey, and how it can be useful, and how working with it can be useful and helpful for your recovery. I want to leave you with this. It is absolutely possible to build the skills to live meaningfully and thrive post-gastrectomy. Absolutely. And in this last slide, I put my contact information here if you want to email me. Again, Amanda Rhodes, and I'm a licensed psychologist with the NIH. I know I talked about values, and I always end all of my workshops or talks with a picture of my values. So there's a picture of my values. That's my husband and my dog, Carl, and we're out for a walk. And I'm really happy that I was invited to be part of this and have one of these slots to talk about the importance of mental health here. I will be at the panel after this. So if you have any questions or comments or discussions, you can find me there and I'm happy to answer them or discuss further. And thank you.